Hi, I'm Catherine from East Haldeman Hospice series of educational videos for caregivers walking in my shoes. Topic 6, what are advanced care planning, goals of care discussions, and health care consent? In Ontario, mentally capable people make their own healthcare decisions. Sometimes, though, people become mentally incapable of understanding what they are consenting to. If the physician prescribing treatment determines that a person is mentally incapable of providing informed consent, then the person's substitute decision maker will provide or refuse consent. So what is mental capacity? The core components of capacity as defined in the healthcare consent are ability to understand the information that is relevant to making a healthcare decision about the treatment or admission or personal assistance, service, and ability to appreciate the reasonable, foreseeable consequences of a decision or lack of decision. It is the responsibility of the healthcare provider proposing the treatment to determine if the person is mentally capable of giving informed consent. In order for a person's substitute decision maker to step in and make healthcare decisions for them, the person needs to be deemed mentally incapable of making treatment and care decisions for themselves. So, what is advanced care planning? In Ontario, advanced care planning is a process that involves having a conversation where a person confirms or decides upon their substitute decision maker and shares their wishes about future health care with their substitute decision maker. Advanced care planning is a way to make sure there is someone who knows a person's wishes and can give or refuse consent for health care decisions. In the future, if necessary, it's a way to give a substitute decision maker the confidence to make decisions that reflect what's important to the person they are consenting on behalf of. The goal of advanced care planning is to communicate wishes, which are based on the person's values and beliefs, to their substitute decision maker, so they can be in the best position to make decisions and provide consent if necessary. These conversations can occur in any setting as long as they are related to future care, not current care decisions. For example, in a hospital setting, they might occur in the contents of preparing the person for discharge or talking about disease progression. In Ontario, the Health Care Consent Act is the law which guides advanced care planning and health care consent. It is important to understand that the laws related to advanced care planning and healthcare consent are different across Canada. Advanced care planning conversations are not consent for future care. Wishes are not decisions. Advanced care planning is a voluntary process. Everyone at any age should participate in advanced care planning. So who is the substitute decision maker? In Ontario, the law provides everyone with an automatic substitute decision maker for health care by providing a ranking list or hierarchy of substitute decision makers. The person or persons that are the highest ranked on this list and that meet the requirements will be the substitute decision maker for health care consent if needed. If a person does not want the highest ranking person in the hierarchy list to be their substitute decision maker, they must prepare a power of attorney for personal care. The following is the hierarchy of substitute decision makers in the Healthcare Consent Act. Note that the caregiver, next of kin, or emergency contact are not necessarily the substitute decision maker unless they are the highest ranked in the hierarchy or designated in a power of attorney for personal care. Starting with a court-appointed guardian, followed by attorney for personal care, then a representative appointed by the Consent and Capacity Board, a spouse or partner, parents or children, parents with right of access only, siblings, any other relative, then lastly, the public guardian and trustee. So, what are the requirements to be of a substitute decision maker? The requirements to be a substitute decision maker are that the person must be willing to act as a substitute decision maker, mentally capable to make the needed healthcare decisions for the mentally incapable person, available in person or by phone or by some other means when a substitute decision needs to be made, not be prohibited by a court order from acting as a substitute decision maker, and at least 16 years of age. If the person that is the highest ranked in the hierarchy does not meet these requirements to be a substitute decision maker, then the healthcare provider must move down the hierarchy to the next person in the list. A person's substitute decision maker is asked to provide consent or refusal for treatment only if the person themselves is determined by the treating physician to be mentally incapable of making their own healthcare decisions. A person's expressed wishes will be used by their substitute decision maker to guide their decision making, to ensure that care is based on the person's prior wishes, values, and beliefs. If the substitute decision maker is asked to make a decision about a particular treatment and does not know of any wishes that the person had that would apply, the substitute decision maker must decide what would be in the person's best interest based on their knowledge of the person's values and beliefs. Goals of discussion. Goals of care discussions occur prior to a healthcare decision that needs to be made right now. Goals of discussions are the conversations that a capable person or their substitute decision maker has with the healthcare team in order to better understand the current illness and for the team to understand the person's values, beliefs, and goals of care. The substitute decision maker involved, because the person is deemed mentally incapable, will now consider the person's prior wishes if advanced care planning conversations have occurred. Goals of care conversations aim to align the person's goals with available treatment options for care. Goals of care are not consent for treatment. Multiple conversations may be required before a person or their substitute decision maker is provided to consent for one of the available treatment options. What is healthcare consent? In Ontario, healthcare providers have the legal and ethical duty to obtain informed consent before giving any treatment or medical care. All healthcare decisions require consent from a mentally capable person, or if the person is not capable, from their substitute decision maker. The only exception is in limited emergency situations as per the Healthcare Consent Act. In Ontario, written instructions are not consent for a healthcare provider to provide or withhold treatment. Consent must come from a person. When the substitute decision maker is required to provide consent or the refusal of consent, they must consider the following in this order when making a decision. Any prior capable wishes that are possible and applicable to the healthcare decision and the best interest of the patient. Before giving consent to treatment, the substitute decision maker is entitled to know what the health problems, concerns, or issues are, the risks, benefits, and side effects, or the treatment being offered, any alternatives to the treatment being offered, and what would happen if the treatment is refused. How is the best interest defined? Your substitute decision maker would have to consider your personal values and wishes, other wishes, whether treatment is likely to improve the condition, prevent the condition from deteriorating, reduce the extent or rate of deterioration, if the benefit outweighs risks, and whether less restrictive or less intrusive treatment would be as beneficial as treatment proposed. What if I changed my mind? Your wishes about your health care may also change. It is important to review your wishes, advance care planning regularly, and to communicate with your substitute decision makers, especially if your health changes or there's a major change in your life. Remember, health care planning is an ongoing process where values and decisions for future health care are discussed and considered. Wishes expressed as part of advanced care planning will only be considered if that person becomes incapable of consenting to or refusing treatment or other care. In the future, if the substitute decision maker is asked to step in, it will be prior wishes expressed in conversation with regards to a person's values and wishes that will guide the substitute decision maker. Advanced care planning respects the wishes, values, and beliefs, including increasing the chance of the person dying in the preferred setting. Advanced care improves satisfaction with care and decreases potential distress caused by decisions. This concludes our Topic 6 video, What are Advanced Care Planning? This video has been made possible due to the generous grant provided under the Resilient Communities Fund of the Ontario Trillium Foundation.